Welcome to this video and audio news release from Recognition PR. Broadcasters, print outlets and other media platforms can use this content copyright free, provided it's set in appropriate context. Tony Stein is the Chief Executive from Healthcare Management Solutions. It has 80 care homes around the UK. Around 3,000 people are in those care homes and around 3,000 staff are looking after them. Tony, we're now on late March. We're on, what is the date today? It's March the 26th we're recording this. The time seems to go by in this unusual emergency. What and how are your care homes coping with the demands on them?
I would say stoically is the word. It's been a very, very difficult time for them, as you can imagine. We have to remember that our staff not only are care home staff looking after our residents, but their wives and husbands and sons and daughters of other people, and they've got their own family worries. These are uncertain times. I think what I will say is it's the typical British spirit seems to be rising rapidly. You know, people are jumping at the opportunity to do whatever they can do to help see the country through this crisis. It's amazing to see. And a great example of that, if I give you one, we had a home manager the other day ring me up and she said, I had a member of staff off with depression, and she's rung me up and she said, look, my problems are nothing compared with the problems that other people are facing. I want to sign myself back on and help and do whatever I can. That's the kind of thing that we're seeing. It's amazing.
Yes, it's affecting so many people in that way, and it's great to see that where they are at the front line in your care homes, that is happening. Now, the front line is being described by the politicians as the NHS, and that is understandable. But the NHS couldn't function without this care facility that you and many other operators are providing, and of course, the local authorities that are working in lockstep with you. So tell me about the process behind the scenes and how you see it fitting in to the sort of supply chain of healthcare that's needed at the moment.
So what we're seeing is that the government funding that they put in, the emergency funding to local authorities to support social care, is working quite well. A lot of the local authorities are contacting us to take our spare capacity. That spare capacity is being used to decant people from hospital that don't need acute care, to leave those beds free for the influx of people with coronavirus and the symptoms that go with that. That said, we are already taking residents into homes that have been tested positive, but who aren't symptomatic, if you see what I mean. So, you know, that brings another worry for our care staff, you know, that they're now knowingly having to make contact and barrier nurse effectively these people. You know, but that's an inevitability. This is what the country faces, you know, and the staff, I think, are doing a fantastic job in the face of that.
Now, I know, because you're so close to your staff, even though there's 3,000 of them, I know they all know you by name and they know how important and passionate you feel about their work. You would like to see more credit given to this element of the care sector because they are selfless, as you've just described. Tell me how you think the country should be responding to these people.
I do want to see more recognition. I think, you know, historically, it's had a bit of a rough ride, I think, as social care. I think it's been seen as a poor relation, if any relation, to the NHS. I think we have always undervalued the care workers, and also, in my mind, I also think that we underestimate those people who support the care workers. But you know, we go on. People are doing an essential job. I mean, it's a difficult job. It's a challenging job. And people give of themselves, not just physically, but emotionally in doing it. And I think we should recognise it. You know, it's time, I think, that we elevated the status of care workers properly.
Tony, look, I think people will follow this and see that there are some internet campaigns going on at the moment, and maybe you can help with this video generate more momentum behind them, and that will be successful. Maybe we do need to see some recognition of some of these dedicated individuals. Thank you very much for joining us.
Thank you.